Measles is on track to hit its highest level in the United States in over 30 years. A mosquito virus with no vaccine and no cure is spreading months early. And the internet is convinced that a hormone is ruining your face. Let's separate what matters from the noise. Measles nears a record. As of July 9th, the U.S. has logged 2,231 confirmed measles cases across more than 40 jurisdictions in 2026, with 32 outbreaks, on pace to surpass last year's total, already the highest since 1991. Officials will review this fall whether the country keeps its measles elimination status. Full breakdown next. West Nile virus, early and severe. The CDC counted at least 48 West Nile cases by June 30th, roughly 5 times the usual pace for that date, and 38 were the serious neuroinvasive form. Arizona's Maricopa County has already recorded 4 deaths. There's no vaccine and no specific treatment, so bite prevention is everything. A weight loss drug gets a new warning. The FDA added a label warning to the over-the-counter version of Orlistat about the risk of kidney stones and kidney injury, worth knowing if anyone in your home uses it. World Cup Health Alert. With the U.S. co-hosting the 2026 World Cup, health authorities across the Americas issued formal warnings for fans covering dengue, measles, norovirus, and heat illness at large summer gatherings. Chikungunya is surging in Tamil Nadu. 8 districts are seeing a sharp rise in this mosquito-borne virus, which typically peaks in July to August. It rarely kills, but the joint pain can be disabling for months. And older adults and people with heart disease or diabetes are at higher risk. A vaccine is now available for adults. Why now? Measles was declared eliminated in the US in 2000. It's back because childhood MMR vaccine coverage has slipped from about 95% pre-pandemic to roughly 92.5%, and vaccine exemptions have risen. That gap matters enormously because measles is one of the most contagious diseases known. Just how contagious? If one person has measles, up to 9 out of 10 unprotected people nearby will catch it. The virus lingers in the air for up to 2 hours after an infected person leaves a room. About 92% of this year's cases were in people unvaccinated or of unknown status. Why it's dangerous? Beyond the rash, it starts like a bad cold, high fever, cough, runny nose, red eyes. Then the rash appears a few days later. Complications include pneumonia, brain inflammation, and death, especially in young children. Measles can also cause immune amnesia, wiping out part of your immune memory and leaving you vulnerable to other infections for months or years. What to actually do? Check your family's MMR status. 2 doses are about 97% effective and long-lasting. Infants 6, 11 months traveling to an outbreak or international area can get an early dose. Ask your pediatrician. If you're unsure whether you're immune, a simple blood test or a booster can settle it. If exposed and unprotected, post-exposure vaccination or immune globulin may help. Call your doctor fast. For the cardiology beat, any severe febrile illness stresses the heart, and measles can rarely inflame the heart muscle. That is myocarditis. Just one more reason prevention beats treatment. Stay safe. A first-of-its-kind kidney drug, Trutacna, was approved July 7th. It is the first treatment to block 2 immune signals, BAFF and APRIL, that drive IgA nephropathy. And patients can administer this treatment themselves as a weekly injection. There is also a new water pill that patients can inject at home. The FDA is currently reviewing the Furoskix ReadyFlow auto-injector. It delivers an intravenous equivalent dose of furosemide under the skin in under 10 seconds. For heart failure patients, This could break fluid buildup at home and prevent emergency room trips. On the oncology horizon, the FDA is due to decide on gedatolisib by July 17th. It is a first-in-class drug for a common form of advanced breast cancer after other therapies stop working. The furosemide autoinjector is the one I'm watching. Keeping a heart failure patient out of the emergency room with a shot they give themselves at home is exactly the kind of practical innovation that changes lives quietly. I want you to introduce my new book, Weight Loss for Seniors.
The science-backed framework for reclaiming your health and metabolism. Struggling with excess weight after 40 is about more than the numbers on the scale. It's the exhaustion of managing fluctuating blood sugar, high blood pressure, and the fear of heart attacks and strokes. Restrictive diets fail, and weight loss drugs offer only a temporary fix unless taken for life. A path with serious long-term consequences. Furthermore, a slowing metabolism is not an inevitable part of aging. It's a biological signal that your body needs a scientifically sound system to heal. Weight Loss for Seniors is your evidence-based guide to sustainable health and vitality. Written by Dr. Indranil Basu Ray, a cardiologist and pioneering medical researcher, this book bridges the gap between ancient wisdom and rigorous clinical science. Dr. Basu Ray's 20 years of clinical experience offer a clear roadmap tailored specifically for adults and elders who want to defeat obesity and its complications, including diabetes, hypertension, and heart disease at the root source.
Inside Weight Loss for Seniors, you will discover food as medicine, how a plant-based yogic diet and structured intermittent fasting optimize your metabolism, ensuring peak daily energy without triggering fat storage. The power of restorative movement, tailored yoga asanas and deep breathing practices that actively reduce chronic inflammation and protect cardiovascular health. The stress and sleep connection, simple meditation techniques to lower cortisol levels, eliminate emotional eating, and restore deep, healing sleep. Tracking for longevity, how to use ultra-modern, non-invasive wearable devices to monitor your health from home without painful finger pricks, including cutting-edge tools to track meditation depth and heart rate variability, HRV, for cardiac wellness. Weight Loss for Seniors is a science-based composite plan, developed by a practicing physician with a 20-year history of treating thousands of patients. It will help you move with ease, wake up energized, and lower your reliance on daily pills. Grab Weight Loss today and build a vibrant foundation for a long, disease-free life.
This week's focus, how little it takes to move the needle. A large 2026 study followed more than 53,000 adults and found the bar for real heart protection is far lower than most people assume. The combination that mattered, about 11 more minutes of sleep, 4.5 more minutes of moderate to vigorous activity, and an extra quarter cup of vegetables a day, together linked to a 10% lower risk of heart attack, stroke, and heart failure. The best results came around 8 to 9 hours of sleep and 40 plus minutes of daily activity. The lesson I emphasize with patients, you don't need a total life overhaul. Small, stacked, sustainable changes, a little more sleep, a few more minutes moving, one more serving of vegetables, compound into meaningful protection. Perfection isn't the goal, direction is. Action this week. Pick the easiest of the three for you and add just a few minutes. Remember, consistency beats intensity. This week, coffee and clearing up the heart myths from an electrophysiologist. Patients constantly ask me if coffee is bad for the heart. Here's what the best recent evidence says. Coffee does not raise the risk of serious heart rhythm problems in healthy people. A landmark trial found it may cause a few extra harmless skipped beats, but not dangerous arrhythmias. So for most people, the coffee causes palpitations fear is overblown. How you brew it matters for cholesterol. Unfiltered coffee, French press, espresso, boiled, contains oils called diterpenes that raise LDL cholesterol. A simple paper filter removes most of them, an easy win for your arteries. Research suggests morning coffee drinkers fare better than all-day sippers. And late-day caffeine steals sleep, which itself harms the heart. This week's move: use a paper filter, keep coffee to the morning, and cap it at a few cups. If you have a known arrhythmia, uncontrolled blood pressure, anxiety, or pregnancy, be more cautious and check with your doctor. The trend: cortisol detox and cortisol face. Millions of videos blaming a single hormone for facial puffiness, belly fat, fatigue, and acne, and selling cortisol cocktails, detox teas, and supplements to fix it, with one hashtag alone getting around 800 million views. The kernel of truth, and this is my field. Chronic stress and cortisol are real, and they genuinely harm the heart, raising blood pressure, promoting belly fat, and increasing cardiovascular risk. Managing stress matters enormously. Where it goes wrong: you cannot detox a hormone your body needs to live. Cortisol wakes you up, regulates metabolism, and steadies blood pressure. Truly abnormal cortisol, or Cushing's syndrome, is rare and medically diagnosed, not something an at-home kit or puffy face reveals. Most people blaming cortisol have a stress problem, not a hormone problem, and obsessively fixing it can add more stress. What actually works? The unglamorous, evidence-based basics I recommend. Real sleep, regular movement, whole foods, and genuine stress tools like slow breathing and meditation. No cocktail required. Verdict: yellow, real biology wrapped in pseudoscience. Manage your stress, skip the detox. This week, the weekend warrior: good news for busy people. If you can't exercise daily, you're not doomed. A growing body of research shows that cramming your weekly exercise into just 1 or 2 days delivers similar reductions in cardiovascular and overall death risk as spreading the same amount across the week. What matters most is the total volume, roughly 150 minutes of moderate activity a week, not how you distribute it. Why it matters: the biggest health jump is from doing nothing to doing something. So if your reality is 2 active days on the weekend, that still counts and it still protects your heart. The cautions as your doctor: if you're deconditioned, don't go from 0 to a 2-hour weekend blitz. That's how injuries and rarely cardiac events happen. Warm up, build gradually, and if you have heart disease or risk factors, get cleared before ramping up intensity. This week's prescription: aim for 150 minutes total, however it fits your life. 2 solid sessions beat a perfect plan you never start. Big M and A, Germany's Merck KGaA, agreed to buy U.S. life sciences firm Bio-Techne for about $11.3 billion. This is one of the larger deals of the summer. France's Ipsen is also on a buying spree with Cardos and a bid for Memo Therapeutics. A catalyst that hit: Vera Therapeutics won FDA approval for its kidney drug atacicept on July 7th. This is a prime example of a pipeline bet paying off. A reminder that pipelines fail. Pfizer's experimental lung cancer drug, sigvotatug vedotin, missed its main goal in a late-stage trial. Even giants have setbacks, which is why single drug bets are risky. Next catalyst to watch: the FDA decision on Celcuity's breast cancer drug gedatolisib, due around July 17th. This is the kind of binary event that can move a smaller company sharply in either direction. Approvals can lift a stock overnight. Failures can sink one just as fast. Follow the data, not the hype. Not financial advice. Our newsmaker of the week is a solemn one. Senator Lindsey Graham of South Carolina died Saturday night, July 11th, at the age of 71, shortly after returning from a trip to Ukraine. This week, the District of Columbia's chief medical examiner released preliminary findings on the cause. An aortic dissection due to arteriosclerotic cardiovascular disease, what most people know as hardening of the arteries. The death certificate remains pending final testing. His family has asked for privacy. Now, as a cardiologist, I want to set the politics aside and talk about the condition itself. Because an aortic dissection can strike without warning, it kills within minutes, and knowing the signs could save your life. The plain English version: your aorta is the body's main pipe, the large artery carrying blood from the heart. To the rest of you, its wall is layered. An aortic dissection is when a tear splits the wall apart. Blood no longer flows where it should, and vital organs are starved. If the aorta ruptures, it's fatal. About 20,000 Americans a year suffer a thoracic aortic dissection, and it's one of medicine's most notorious mimics. Actor John Ritter died of an undetected dissection in 2003, initially mistaken for a heart attack. The symptoms: know these: cold, sudden severe chest or upper back pain, classically described as tearing, ripping, or stabbing. This pain is often felt between the shoulder blades. It's maximal from the very first second. Unlike a heart attack, which builds, dissection pain may migrate as the tear extends. It can also show up as fainting, stroke-like weakness on one side, or a cold, pulseless arm or leg. Critically, a normal EKG, chest X-ray, and routine blood tests do not rule it out, which is why it's missed. Who's at higher risk? The single biggest risk factor is long-standing high blood pressure, present in most cases. Other factors include age, atherosclerosis, a known aortic aneurysm, or connective tissue conditions like Marfan syndrome. A family history of heart disease matters too. Graham's own father died of a heart attack at 68. How it's diagnosed: speed is everything. Suspicion is the key. A doctor has to actively think of it. The definitive test is a CT angiogram of the aorta. A transesophageal echocardiogram or MRI are alternatives. A blood test called D-dimer can raise the flag, but advanced imaging confirms the diagnosis. Treatment depends on which part of the aorta tears. A tear near the heart is an immediate surgical emergency. Tears farther down are often managed by aggressively lowering blood pressure and heart rate, sometimes with a stent. When the first symptom is collapse and cardiac arrest, even perfect CPR and fast EMS are often not enough, which is exactly why prevention and early recognition of this condition matter so much. The life-saving takeaway: if you or someone near you has sudden severe tearing chest or back pain, call 911 immediately. Don't drive yourself, don't wait it out, and don't assume it's muscle strain or indigestion. And the best prevention is simple: control your blood pressure, don't smoke, and manage your cholesterol. The same arteriosclerotic disease behind most heart attacks and strokes is what weakens the aorta. Standing disclaimer: this is general education, not medical advice. In an emergency, call your local emergency number. Welcome back to Ask the Cardiologist. Question 1. I get palpitations after coffee. Do I have to give it up? Not necessarily. In most healthy hearts, coffee causes occasional harmless skipped beats, not dangerous rhythms. Notice the pattern. If palpitations are brief and you feel otherwise fine, moderate your intake and keep it to the morning. But if they come with chest pain, fainting, breathlessness, or a racing rhythm that won't stop, that's a see a doctor and get an ECG situation, not a coffee question. Question 2, my smartwatch says my heart rate drops to the mid-40s when I sleep. Should I worry? Often no. A resting or sleeping heart rate in the 40s is common and even healthy in fit, active people. The heart is simply efficient. What matters is whether you have symptoms, fainting, dizziness, or extreme fatigue. A low number with no symptoms is usually fine. A low number with those symptoms deserves an evaluation. Your watch is a screening tool, not a diagnosis. Bring the data to your doctor. Question 3, I was vaccinated for measles as a kid. Am I still protected? Almost certainly yes. 2 documented doses of MMR are about 97% effective and give long-lasting protection. No booster is routinely needed for most adults. If you only ever had 1 dose, were vaccinated before 1968 with an older version, or aren't sure, a quick conversation with your doctor or a simple immunity blood test can confirm it. Keep your questions coming in the comments. The best ones make next week's show. Welcome back. Here is your cardiology brief. This week, check your family's MMR status. And always make sure to filter your coffee. And remember, 11 more minutes of sleep is a real win. Drop your questions below for Ask the Cardiologist. Subscribe so you never miss a Friday, and I'll see you next week. Stay well and stay informed.